get started by just providing a general overview and framing about the work that's happening due to Act 183, also previously S11, and then go into some more detail about those various streams of work. But I did want to talk for a moment just about the breadth and depth of those activities. And you probably were able to observe, if you've taken in Act 183, that there are quite a number of activities that are prescribed by that legislation. And as you're familiar, some of those activities align really directly with the Healthcare Workforce Development Strategic Plan. So it is very exciting. However, the kind of sheer magnitude of those activities is one that we have to balance with our staffing resources at the Agency of Human Services, in particular, to be able to kind of staff up and bring these programs into reality and into being. And we also are working a lot to ensure that the programming is going to be meeting the requirements of the funding source that was allocated for this programming. The State Fiscal Recovery Fund is the federal funding source that the legislature allocated for the large majority of the workforce development programming and activities that are in Act 183 and are prescribed for the Agency of Human Services. And that means that we have to work within the federal funding parameters, and those parameters can be quite narrow and they can be quite tricky to navigate in, so that what we're having to do is balance the legislative intent with the parameters of the federal funds. And we have to do that in collaboration with the great resources that we have at the state of Vermont to be sure that we're working within those federal fund source parameters. But it does take time. And so that work has been happening diligently over the summer, but I recognize that some of the programming is not yet available. And that is because of the kind of development that we need to do. Again, being mindful of the legislative intent and trying to deliver as best we can on legislative intent, while at the same time doing so in a way that is going to protect the state as it works with these federal funds. So that's just a high level framing for these activities and what's in play. And things are moving forward. The other piece is that the Agency of Human Services does need likely some support to administer these programs. These are, entirely new programs for the agency. They have to be administered. They have to be administered over time. They require some additional resources that we are needing to convene. So with that, I'm going to ask Wendy, my colleague, if she can provide a more detailed update on some of the programming that has been in flight relative to Act 183, specifically premium pay programming. And from there, we can have discussion and move through to our next agenda item after that.
I'm going to try to share some slides here, just provide you some more information on the current program, and then understand. Sorry, I've got to go through. Here we go. Can everyone see my slides? Am I sharing at this point? Perfect. Many of you are aware of the Premium Pay for Workforce Recruitment and Retention program. That program has $60 million in funds that was appropriated through Act 83, Section 72, and it has multiple funding sources. So those include some federal funding we got related to HCBS Enhanced FMAP, the SFR funds that Ina referenced that often have sort of more limited parameters related to Treasury guidance, and some general fund. So the first program that has rolled out has been available to eligible employers as described in statute. Those are listed here. It includes assisted living residences, nursing homes, residential care homes, home health agencies, DAs and SSAs, substance use treatment providers, recovery centers, adult day service providers, our AAAs, and DCF's residential treatment programs. We started making payments on this program in June 2022 and made payments throughout the summer as applications were reviewed and approved. We have awarded $32.4 million to 132 eligible employers at this point. We're really still trying to get a few remaining applicants over that finish line, so that number could go up to slightly less than $1 million if we can really get those applications completed. We provided an opportunity for the applicant to choose to either take a one-time single lump sum payment that they could disperse over 90 days, or to get quarterly payments that would be dispersed by June 30th, 2023. And those happen through a quarterly reconciliation process. So the actual majority of our applicants are sort of nearing the end of their programming because they selected that one-time single lump sum payment. I'll note that the employees that they provide funding to for recruitment and retention programs in the form of premium pay are required by statute to make a service commitment of at least 3 calendar months. So hopefully we'll be able to start seeing some positive outcomes of this funding. We'll be collecting both reconciliation data and outcome data so that we can understand how this funding has impacted vacancy rates over time, see how it's successful. We do expect to have a second round of funding by statute. I think we are allowed to do that and make that available for additional healthcare and social service providers. As I mentioned on the last slide, these are the eligible employers that were indicated. We can make this opportunity available to more healthcare and social service provider types. Per the statute, this funding would be to those individuals or those entities with a demonstrated need for the funding. So we've started having conversations and welcome additional input on those provider types who really could benefit from this program and would have a demonstrated need, like criteria we should use in demonstrating need, as well as funding uses. We do, I think in terms of thinking about which of our dollars are left over from the Premium Pay Part 1 program, there's a little bit of HCBS FMAP funding left over, which is a more flexible funding source, except for it is restricted to HCBS providers. A significant amount of the leftover money is the state fiscal recovery funds. So those funds are, as Ina mentioned before, slightly less flexible, and we have to go through that activity of working with the agency of administration and their contractor, who are really helpful in helping us make sure that the funding we spent does not put the state at risk of being an ineligible use. So that's going to be an important step in our process of this is how we want the program designed. How can we actually effectuate that within the rules of this program? We still also have general fund. So we're going to have to take our ideas and figure out what's feasible for us to implement and what's allowable to implement and what are the best strategies to meet our current workforce needs. So I don't know how much time you want to allocate to this part of the agenda, Ina, but I think it would be, we definitely welcome input now or later on ideas for use of the second part of the program funds.
It's always nice to pause when you're presenting, and it's always nice for people to have the opportunity to provide feedback when they're thinking about something. So I'll open it up here to hear from any of the advisory members about recommendations or thoughts around, I think in particular, the second round of funding that we would be making available for retention activities, recruitment activities as well.
I guess I have a question. This is Becky Capsalis from the UVM Health Network. Did you do outreach to organizations and suggest that they apply for this, or did people apply for it on their own? I'm just like concerned, thinking, oh my goodness, I hope somebody from the UVM Health Network applied for this, because certainly we could use it. I'm just trying to understand how people are considered for it, how they do it, how they know to do it.
Sure. Yes. So I'm going to go back to the first slide. So at this point, we have only stood up the part of this program. You'll note the eligible employers for this program are all AHS or its departments providers. So we were able to reach out directly to all of those provider types and use our departments to really encourage application. And we did actually have really good uptake from these provider types. So you are less knowledgeable about it because the hospitals weren't part of this first group.
Okay, that's good. Thank you. I was like sweating, like, oh my gosh, how did we not know this? Okay.
But the next program allows us to identify who would be an eligible healthcare and social service provider. So I think as we identify that, we would have a different communication strategy because it may be broader beyond our known provider networks or different provider networks.
Stephanie.
Thank you. Just a question. Sorry, I mean, I appreciate the overview, and I think I'm very pleased that people could take advantage of it. And I completely appreciate the limitations of some of the funding too. For the next round, what is the time frame anticipated? And does that also end in June 30th of 2023, or is it beyond? I can't recall if we've talked about that.
Yes, the June 2023 was specific to the first part of the program. What we do run into is, depending on how the program's set up, we have to fit within the SFR rules. So SFR rules related to premium pay are related to the time frame that is the public health emergency set by the presidential declaration. So if the program looks just like this one, then we have to be within those time parameters, which unfortunately are unknown, but that make us really feel like we need to prioritize and get this next program started up. And I think we'll have more time where we're working on we'll be educating providers as early as next week on the reporting and reconciliation process, and then should be able to really do a better job at getting this stood up quickly, because although SFR funds have to be obligated by, I believe it's December 31st, 2024 and spent by 2026, if it's premium pay, it has that public health emergency time frame tied to it as well. There's a lot of puzzle pieces to kind of put all of these, our wish list, the legislative intent and the funding source together. Do I think in terms of getting feedback, we'd love feedback sooner than later, knowing that we have to start standing this up quickly, but there is still time where obviously if you get us something within the next couple of weeks, we'll be able to have an informed program design.
Mary Kate?
Yeah, and kind of picking up on that, Wendy, what is the time frame for feedback? I know you're saying within the next couple of weeks, but is there a drop dead deadline you're aiming for?
I don't have a drop dead deadline, but it's a high priority. So okay. I would love it if it could be the end of this month. I don't want to necessarily arbitrarily cut it off at this point, but but I would personally like to be able to start buttoning this up by the end of this month.
Yeah, I think we can, if it's helpful, we could follow up with an email and a hard deadline for that feedback. And if there's feedback that you want to gather that you don't have to offer today, which is completely understandable, but we could do that to make sure that you have that deadline firm and can gather your feedback with it in mind.
And have you been able to get a better sense of how the different funding sources break down in terms of proportions that are less restricted versus more restricted?
We do have that breakdown. I think then when it comes to is just how many different program types can we stand up to?
Okay.
The vast majority of the money is SFR, so that obviously is going to have to weigh into a large part of the program design. I think then it comes to, are there a certain number of other activities that could be funded that are less restrictive? What would that look like? And being able to have the capacity to do that in a timely manner.
Yeah, and I guess one last question, or maybe it's a comment, maybe it's a question. I don't know. We'll see where it ends up. So the idea of kind of what you do with the money then versus who qualifies for it, I think we've certainly talked about different uses for it, but I think one of the things that really is kind of rubber meets the road is the criteria for eligibility. And so I just wonder if there's going to be another discussion around that eligibility. I know we've talked about what's the term I'm looking for? Like rollover rate, not retention, but the opposite. Turnover rate. That's the word I'm looking for. Like what the turnover rate is, because a lot of times it may not be a vacancy, but you're seeing a lot of turnover in an organization, which is very costly to that organization, takes up a lot of time, resources, takes people away from their jobs so that they can help train the new people, which is, has an impact on access. So I think like the turnover rate, capacity to extend funds for bringing on new applicants. I'm just thinking we don't want to get into a place where these funds can be used to poach other organizations' staff. I want to make sure we're avoiding that, to coin Jill Olson's term, arms race with our staffing. We don't want this to exacerbate it. So I just would call that out as potentially another criteria. And is there going to be, like, are you guys going to put forward some recommendations on criteria that we can react to, or what's some kind of the process of this?
The process is still under development, but I think if you have suggestions on ways that would be most useful for providing feedback, then that's something we can probably do. If you're sort of interested in what are some of the various ways that we have gotten feedback on and some of our thoughts, can we bring that back to some group or subset of group? I would say we can likely do that. That would be very helpful.
We too are cognizant and concerned about the, potential that that recipients of the funds can then use those funds, for lack of a better word, to cannibalize other employers' employees. I think that we would really appreciate your thinking around that issue and your recommendations for how we might structure the program in a way to avoid that as much as possible. Of course, we do, in the current program, the awards are intended for recipients that are committing to service at the organization. And so that is one key test that is in place. And we recognize that there are different degrees of ability to really retain individuals and that people can move freely between employer types at the end of the day. But that is one of the key provisions or kind of hallmarks of the program that's intended for the program to be about retaining. And so other ideas would really be helpful to us because we share the concern and we realize that it is a potential reality, but we'd like to think creatively about how to address it.
It's this, and I should know this, but is this group meeting monthly, quarterly?
The group has been meeting less than monthly because of the summer time. And I think, the difficulty with a monthly meeting cadence during the summer months, but that is something to discuss today. I think as we are really now looking to, we're doing a couple of things at the agency. We're looking to hopefully bring a contractor into the fold, working with us to be administering these programs so that we can be doing so quickly and administering programs, that simultaneously, because we have several of these programs that need to be underway. And that means that we may really benefit from meeting more regularly with the group on a monthly meeting schedule instead of kind of what's been more like quarterly, because we really took the summer time and we were not meeting during the summertime. So the group's feedback on that would be helpful. I do think, given all that's in motion, that monthly might make a lot of sense.
So that would probably allow a greater opportunity to dive into what we've received and the analysis we've done on that input we've received on this second part of the program, if we could meet again in a month.
Absolutely. And I think same would hold with the apprenticeship program that we're going to discuss as well. And other pieces of work that will be in flight too. I saw one thumbs up from the group in terms of a monthly meeting cadence, and please offer your feedback. Feel free to put it in the chat during the meeting time as we're talking, or feel free to send us an email if you have any particular comments or opinions about a meeting schedule. Any further questions or comments on this particular initiative? Which is an initiative that is consistent with the strategic plan, but is not an initiative that was provided for in Act 183 because it had been already funded through the Budget Adjustment Act.
This is Jill. Can I just make a comment?
Yes, please.
Thanks. Sorry, I can't raise my hand since I'm driving. Just in terms of process, I'm really finding myself struggling to keep up with everything that's happening. We didn't have these meetings over the summer, but we did have plenty of healthcare reform meetings over the summer, and there's a lot of overlap between this group and that effort. And, it's actually hard as an association person to fully understand what's happening on the ground operationally for members and to offer you the level of detail that I think you need, because we have to do a lot of surveying of people who are pretty busy in order to do that. So I feel like process-wise, and I know, I've talked about this for my members, but I want to say it for everyone. I actually think I need more of you guys coming to my folks so that we can have more of a discussion with them, because I might not ask the right question. I might not ask the right follow-up question. It can be really hard to actually elicit the amount of feedback that we need to offer you meaningful input. So I think a lot of associations do what I do, which is we have pretty regular policy and legislative calls with members, and having you guys make the rounds on some of those might actually help us kind of move a little quicker. It's really hard to get people to answer email surveys in the current level of stress that's out there, at least for my folks.
We're open to doing that, and we can do our best to accommodate as many kind of those of those making the rounds as we can. The other piece that we do have in motion, and that does tie back to kind of what we were talking about the fund source and the activities that are all laid out in Act 183, is the positions for the Agency of Human Services to hire a workforce strategic plan development coordinator. So another position. And I think with that I anticipate that I'll be directing that individual to be very hands-on with the membership of this group and other organizations as well, ongoing, because there are so many pieces of work that rely on those touch points. But until that person comes on board, we're definitely willing to be going more directly for input. We're happy to do that. But I did want to name that piece as well, because it's also, I think, going to be really important for our success, because there are many things going on at once, for sure.
Yeah, I think that would be helpful. I mean, I think even for the new person to be coming to our folks, I mean, that'll give you more capacity for that. There's just no substitute for like a, having members talking to each other and sort of bouncing at, sort of creating more conversation than the sort of static, like I send them a survey and maybe they answer, maybe they don't. So I don't know. I just think I get better information that way generally on almost any topic. Thanks. Thanks for considering it.
Yeah, I think that makes sense. I also know, from our own experience, that when there's a lot of work and there's a shortage of resources to do that work, that it's really difficult to find time to think beyond the work that's immediately ahead of you. So I know that having resources come to the work site, if you will, could really make that a lot easier. It's hard to find the time to carve the time to do that unless it kind of gets right in front of you.
Yeah, exactly it. That's exactly right.
Any other discussion on this topic? And should we move on to talking about, I believe the apprenticeship program is our next agenda item.
Great. Many of you probably are aware of this program, but I'll just give a little overview to start. So this is one of the Act 183 programs, $2.5 million appropriated through, again, the state fiscal recovery funds to provide grants to healthcare employers to establish or expand partnerships with Vermont nursing schools, to create nursing pipeline or apprenticeship programs, or both, that will train members of the healthcare employees' existing staff. Healthcare employers is defined in this statute, as noted here on the slide. So hospitals, long-term care facilities, designated and specialized service agencies, FQHCs, and other healthcare providers. So we have, as Ina has indicated before, I've been working with the Agency of Administration and their contractor on figuring out how we can use funds per the statute to really meet that intent. So we have identified that we can use those funds for enhancement of healthcare capacity to mitigate and prevent COVID-19. So those funds would be used to upskill healthcare employees. So in relation to the statute, that's the PCAs, LNAs, and LPNs. And those funds would allow them to become higher level nursing professionals. The funding could be used to cover those trainees' tuition and fees at Vermont nursing schools. And healthcare providers receiving grants would be expected to make contributions to assist trainees in meeting their living costs, such as housing and childcare, while attending the program. So that's a requirement within the statute, but that's not an allowable use of the SFR funds. So where the statute also indicates it's seeking participation from the healthcare employers that are participating, this is an area that we think we would probably be requiring of an applicant.
Does that make sense to the group? Okay. Thank you.
So we, again, we're in this kind of the stage of we understand now what the SFR allows within the statute, and now we're trying to come up with the, what do the parameters look like of this program within what we now understand. And we were hoping to bring on a consultant to help us too in this program design and implementation. So we've asked the advisory group members to help us with a survey, which we got in this notes I wrote 8 respondents. I know we got another one today and are happy to receive more responses, but this here, the summary I'm mentioning today is related to the first 8 that came in. So some of the comments that we heard were other healthcare employers that could be also would be helpful to be eligible would be the primary care practices, pediatric practices, and oral health practices. We had a lot of really helpful comments on models of successful partnerships in Vermont today. So many described partnership pipelines, apprenticeship programs, clinical rotations, and scholarship programs that they have with the variety of Vermont educational institutions, other schools in the Northeast, even online programs in high schools. It was noted that partnerships are really needed at more provider types than exist today. We heard some challenges. We heard resource challenges with running apprenticeship programs at the providers. Those are human resources and other just coordination functions. We've heard many locations, including here, there's insufficient nurse educators and nursing program slots. And then not all providers will be able to participate financially. We heard this from a number of respondents, including some of the hospital respondents. We also heard from nursing school participants that students have left programs due to the need for financial assistance. And we did get further detail from a hospital respondent about the types of needs that their staff have had related to transportation, housing, childcare, food, family necessities, and uniforms, as well as some of those educational needs in order to get to that next higher level of the profession, such as board exam study support and reexamination funding. We had asked how the state could be more so. Oh, go ahead, Dina. I think you were going to say something.
I don't want to harp on what we can't do, but I think it's important to go back to those areas where there have been, noting that the need for that wraparound support is important: housing, childcare, food, family necessities, etc. And I think it's important to restate that those are not allowable in terms of costs for the apprenticeship program when it's funded by the state fiscal recovery funds. So I don't want to harp, but I do think it's important to be consistent and clear about what we can and cannot do in the program.
It's true. And I think to that point too, what we would say is perhaps a successful application may include how we could make that package of services together with the support of the applicant plus the support of this funding. And then the respondents also indicated the state could be helpful in really bringing together the healthcare employers and schools or making these more successful by doing things like program administration, either centralization to help manage programs across the state or funding for on-site coordination of the program, fostering connections between schools of nursing and facilities, a centralized clinical placement system for all educators and employers, and information about available resources and economic supports for employees in the pipeline. I think we'd love to continue having discussions on how we can really be supportive above and beyond what the grant allows us to do in order to make these partnerships successful. Love to hear feedback, continued feedback. Stephanie?
Thank you. Just to clarify, these particular funds are for nursing. So even though you've got feedback from employers that they would wish to have other disciplines added, we're not talking about that piece of it for this program. This is related to nursing, right?
I think it's various provider types, but who employ nurses. So
Right, to move into the
yes.
nursing pipeline. So even though they mentioned oral health, for example, if that person was interested in going to nursing and that was relevant for that, then that would be a path, but the path is to go to nursing, right?
Yes, that's a very
Perfect.
good point. So it's those
Yeah.
employers who have PCAs, LNAs, and LPNs who want to be higher level nursing professionals who may or may not be in all of those provider types. I
Great, thank
think
you.
that's a very good observation. Betsy?
Hi, I just put a question in the chat. I was curious if, using the term higher level nursing professionals, would this be eligible for a clinical faculty pipeline that would include a joint appointment with an academic organization? So growing nurse educators essentially through a pipeline type program. They're just not, RNs aren't listed here in the list, and so I didn't know if it's exclusive.
I think so could an RN become a higher level nursing professional? I'm gonna have to go back to Act 183 to see if it is. It doesn't, so Act 183 doesn't list RNs. I think we can take that back on how restrictive this language is intended to be. I'm reading it as saying you have to be a PCA, LNA, or LPN, but I think that's worth a discussion to make sure that's an accurate interpretation.
Other thoughts about the program design and the feedback received? Brian?
Yeah, our institution is certainly willing to help out with housing and childcare. The issue at times is there's a lack of housing to help with. So I don't know how we might get around that piece. I mean, we're looking at some additional spaces here, but I wouldn't want that to potentially hold us up.
I don't think the statute requires housing. Obviously, that would be very attractive if people had ideas on how to do that, but I believe the statute is focused more on I'm gonna look at the legislation while others say things, sorry.
I'll say something, Wendy, while you do that, which is, I think, and pending the review of the statute and what it says, I think that we're envisioning a program that would be flexible enough such that the employer could indicate for us and our needs and those who we want to support in advancing along the pipeline. Housing is an issue, and we have this particular way that we can support. For another employer, maybe the key issue is really providing for a peer group and mentorship component for those persons who are earning additional credentials, and that employer might indicate that would be the employer supported part of the programming. I think we'd like to be flexible, recognizing that different employers are going to have different needs for their employees who would be looking to take advantage of this opportunity. And I see Wendy's nodding her head there as I'm saying that, so I'm hoping that that's certainly something we want to honor, that different employees are in different places.
That's right. And it is just that language, that's such as housing and childcare. So I think it's reflective of these are the living costs that many people have need for now, but I don't think we have to only accept applications from people who can offer housing and childcare. I think we would be asking the applicants to describe how they could assist their trainees with these social and financial needs.
That being said, the advocacy and the continued the continued focus of this group and others like it on the issues relative to housing and childcare are really important for us to be funneling back to the State Workforce Development Board for the overall workforce development issues, and certainly important for the group to continue highlighting in as many forms as possible, because there are some avenues certainly to support the housing situation and in terms of childcare as well. Lisa has her hand up.
Hi, thank you. Just a couple of comments coming from the kind of academic side of this. I know that we partner with several facilities around the state to deliver nursing programs in multiple, I guess, levels of support from the facilities, depending on what is, what they're able to give or what we've built with them. And just, one of the things I do want to comment on the living costs that on our side from students that are going back to school and wanting to further their careers and kind of build themselves from one of those entry level kind of nursing positions to something like an LPN or an RN. Those are really important. Our biggest attrition and the students that we lose every year are all because of food insecurity, living costs, and childcare. Childcare and food are probably the two biggest ones. So, anything that we can build in to help with that will help these students become successful and be able to make it through the programs, because it's great to have the program, but if we can't get the students through it, there's no point in keeping it. The other thing that I will say, again, kind of coming from the school side of things, I work with multiple agencies across the state, and every kind of plan or, partnership that I have with the facilities, they're completely different pretty much with every single one across the state. And it does make it a little difficult on our end to manage that, because everything is so different. And I understand every area in the state is very different and the needs are different for those students, but it would be great in utilizing this money going forward, especially if we're going to keep getting money to do this, to come up with some kind of structure. And I know I've been working really closely with the health network, and we've come up, and we've worked really well and come up with some good structure there. And I think that's a great start. And I think maybe coming up with something across the state that we could use as a baseline for developing these programs that we can build upon and add kind of those nuances for each area, but it already has like the basis built, instead of having to start from the bottom and build this whole program every single time, because it's very time consuming. And then it takes, at least 2 years to get a program started at an agency. So it would be great to have something that, everyone could maybe agree on, that we could use as a starting point, and then it would make this process go a lot quicker. So, thank you. I thank everybody that's worked with us and that we partner with. It's been, an incredible process, and we've put many students through, and we're still working on it. And I think, this is a great thing for students, but there are some points that we really need to fine tune for folks. Thanks.
Thanks,
Your
Lisa.
Your comment
Go
about
ahead,
it taking 2 years is really interesting to me, because it makes me wonder if really these funds would be useful to entities looking to create a new partnership, if really they need to be obligated by December 31st, 2024, or if there is space to allow those new partnerships to begin and cover those employer costs. I'm not sure if there's like a faster pathway where some of those new entities could still create a program and enroll their students. I know we're running out of time though, but I don't know if you have a reaction to that at all.
Yeah, I mean, I think it definitely can be done quicker, if we had that framework in place, where, and also knowing, having those resources in place with someone to teach and, the clinical faculty and all of those things kind of, those are the things that take the most time, and getting the students through, prereqs and all of those sort of things. So yeah, I think we could make it a faster process for sure.
And I know Elizabeth Code had her hand up. I don't know if.
Sure, thank you. I was just looking at bullet number 3 and had some questions about that as far as the funds covering trainees' tuitions at the existing nursing programs, the 4 programs throughout the state. I'm just wondering what we know about the current capacity. One of the things that AHAC kind of struggles with is we can create a lot of interest in the profession of nursing with young people, but as we try to drive them to programs, ideally in Vermont, so they have Vermont-based experiences, we run up against, we're creating higher number of applications, but for the same spots. So we're creating a more competitive program, but we're not enrolling more students or creating more nurses at the end of it. So I'm just wondering if we have a sense of where is their existing capacity right now in those nursing programs so that we can start to feed students directly into those? And is there any existing capacity? Thank you.
I think I can probably speak a little bit on that. I can say the southern part of the state, we have quite a bit of capacity down there. We, at least on the Vermont Tech side, and even the Castleton side, we have a lot of open seats down there that never get filled every year. We do have the LPN, ADN, and then we have a BSN program down there as well. So that is one area that we really are trying to recruit folks down there to try and build our numbers up. The central part of the state, a lot of these nursing pipeline and apprenticeship programs are working directly with the facilities. So it doesn't necessarily go into our capacity that we have currently. It's really dependent on the facilities as to what they're willing to work with us for and what they're willing to provide us in terms of clinical experiences and help with clinical faculty. Those are kind of our sticking points of where we're getting bogged down. And so, all of the partnerships that I've done in the last 2 years have always been kind of working with the facility, them helping us with space, them helping us with providing a clinical person. And we've been able to add, 9 seats every year and kind of keep growing those programs in those areas. So we do definitely have some space to grow, but it's really dependent on those 2 things, getting us clinical space and getting us clinical instructors, which a lot of facilities have been willing to help us with. And, for this to work, we would need to keep going with that.
Betsy.
I think just to add on to a little bit of Lisa's comment, I think there's even an opportunity with the programs that we have in place to really match the student that's applying to the appropriate program. I think that Norwich's accelerated BSN program, which is 18 months long, is really underutilized in the state because I know that many of VTC ADN nursing spots are actually taken up by people who already have college degrees and could be better served in Norwich's ABSN program. So I think even just understanding what our programs are offering, what types of programs they are, as well as who our learners are, and finding a way to manage resources at a centralized level to sort of offshoot people into the right program.
Thank you. That was helpful.
That was also a really helpful question, Liz, in terms of segueing into one other area that I wanted to be sure to touch on in our meeting time today, recognizing there's 1 minute left, but we'll send a follow-up email, but to say out loud that we do have to convene a working group that really is looking at the capacity in the education system for additional learners, and that takes on issues and questions such as a statewide preceptorship model. And that is something that we'll be looking to do this fall. And I'd really like recommendations from work group members about the ideal participants to contribute to that working group. I think we just heard some of our membership here that may have some fabulous ideas for that working group, but would really like you to share with us some names of participants as we look to get that off the ground, also consistent with our obligation in Act 183. Wendy, do you have any final questions or comments that you wanted to be sure to make or to ask of the group before we?
No, I really appreciate everyone's time responding or getting others to respond to the survey. We're still open to keeping that open if you have anyone else who wants to participate, but we want to continue these discussions with you as well. So look forward to having more of these meetings of this type.
Thank you. And I know that Liz has just put a question in the chat about the work group, and I'm going to try to answer her quickly because I'm not sure that she'll have the chance to be able to see it in the chat after the fact. It is for nursing students and nursing programs, Liz. Okay. Thank you all again for your time today. It was great to see everyone. We're looking forward to launching into seeing you monthly again, and to continuing all of the work with you, and certainly driving from your expertise to complete the work that we have in the Workforce Development Strategic Plan.
Thank you.
Thank you.
Thank you, guys.
Thanks.